Hi, Ezra. I will be taking you today on health statistics, and our focus today will be on some rates. Okay, so this lecture is primarily for community health extension workers, students in year three. Okay, so today we'll be looking at crude birth rates, and we said this is the live birth occurring sometimes registered in the calendar year divided by the total population of the area in the mid-year, expressed per 1,000. So it's a rate we expect per 1,000 population, so to determine how fast it's occurring. Okay. So the formula is total number of live birth in a year over the mid-year population. Okay, so that is the formula used to calculate crude birth rate. Okay, the crude birth rate is an essential demographic indicator that measures the number of live births per 1,000 individuals in a population over a specific period. It provides valuable insights into the population growth, fertility pattern, and overall health of a society. For example, in a city of Mo with a population of 100,000 people, in the calendar year, there were 1,000 live births that occurred or that were registered. We can calculate the birth rate per 1,000 people using the formula above. First, we need to determine the live births occurring or registered in the calendar year divided by total population of the area in the mid-year. Okay, so this can be obtained from the health centers, hospitals, and all of them. You can get the total number of live birth from the birth certificates issued, okay, and also from hospital records or health center records. Okay, so for us to determine the crude birth rate, we obtain this value from these hospitals and health centers, okay, and divide it. Okay, so now from our example here, they said the population, the mid-year population of Mpo was 100,000 people, and in this year, let's 2023, there were 1,000 live births that were recorded. So for us to get it, it will be the birth rate would be 1,000 live birth, that is total number of live birth, divided by the mid-year population. Okay, divided by the mid-year population. Okay, so which will now be equal to 0.01. So to express this as a rate per 1,000 people, we'll multiply it by 1,000, which will not be, the birth rate will not be 10. Okay, so therefore the birth rate in all would be 10 per 1,000 people. So by the time you compare with 100,000, it will now be like, since it's 10 persons per 1,000, then for 2,000 people, it would be 20. For 3,000, it will be 40 until you get to 100 people. But for analytical purposes and for easy understanding, it's 10% per 1,000 people. You can also change here to for us to do a higher calculation, but for easy understanding and for epidemiological reasons and studies, it is 10 per 1,000 people. So this means that for every 1,000 people in Mpo, there were 10 live births occurring or registered. For if you count 1,000 persons out, inside that 1,000, there is 10 live births among them. So until you can get to 100,000 people. Importance and use of the crude birth rate. It is used for population growth. The CBR helps in understanding the rate at which a population is growing. By comparing the CBR with the crude death rate, which measures the number of deaths per 1,000, we can determine whether a population is growing, stable, declining. It helps us to determine what is known as the demographic transition stage. Okay? A higher CBR than CDR indicates population growth, whereby the crude birth rate, number of people who are being given birth to, are higher than people who are dying. Okay. Another importance is that fertility pattern. The CBR is a useful tool for analyzing fertility pattern within the population. It helps to identify variations in birth rates across different regions, socioeconomic groups, or demographic segments. This information is crucial for policymakers, healthcare professionals to develop targeted interventions and family planning programs. So you can use it to know, okay, this population is growing too much. We need to regulate the population. We can also use it to make plans, okay? Is to make plans whereby the economy is very hard, like that of us now. We'll talk about, okay, we need to develop targeted interventions to reduce our population. But or if our population is dying, like we're not growing at all, and the workforce demand is high, we can develop targeted intervention to boost the fertility pattern. Planning and policy development. Government and businesses use the CBR to plan for future needs, such as healthcare, education, housing, infrastructure. Okay, so a high CBR indicates a need for increased resources and services to support a growing population. So as CBR is increasing, it actually means that the population increases. So therefore, there's need for education, food, agricultural boost, employment opportunities, and all of that. Provision of housing and increase the workforce. Okay. Health and development. The CBR is closely linked to the health and development of a society. High birth rates can strain the healthcare system. Yeah, and when there is much birth, the existing healthcare may be overstressed. Okay, so it helps for timely planning. Okay, it also leads to challenges in providing adequate prenatal care, safe deliveries, postnatal support. Okay, so monitoring the CBR helps identify areas where healthcare services need improvement and where investments in maternal and child health are all required. Another use is economic implication. The CBR has economic implication as well. Yeah, it has high economic implication. A high birth rate can contribute to larger workforce. Yes, like China. China is almost China is almost half of the world, and China have made use of their population. Now, almost everything that's been manufactured in the world, China are the one doing it. Okay, so it adds in or to plan for contributing to the economy we are having. Okay, and therefore, in China now, it's now potentially driving the economic growth. So when you determine your population growth as a country or as a community worker, you determine the population, the CBR of that community, and if they're overgrowing, or they're growing, or they're not growing, you can sit with the community development because the birth rate is high. Therefore, it means there's need for us to expand our health center and get adequate staff. So we need to write to the government. And since and we have limited housing, which means there will be overcrowding. We have limited schools. We need additional teachers as a planner. Okay, so it is very important. It also helps us in international comparison. So we can easily compare Nigeria, China, and other countries to know who has a higher CBR than other. So other indicators to use age-specific birth rates, fertility rates, and all of that. Okay, so that is all for crude birth rate. All right, so we'll quickly look at another today. We'll look at also mortality frequency measures. These are measures we use to monitor the mortality pattern in a country. Okay, one of them is infant mortality, and we say this is the ratio of infant death occurring under 1 year to the total number of live birth within the period per 1,000. We always express in 1,000. Okay, so this is the formula: number of infant death under 1 year, under 1 year of age, reported during a given time period, over the number of live births reported during the same time period. Okay, the health of the mother and infant in turn reflects a wide variety of factors, including access to prenatal care, tobacco use, proper nutrition during pregnancy, postnatal care, behaviors, sanitation, and infection control. So this particular indicator helps us to determine a lot of things. It's very, very crucial. In fact, at community level, every community, their infant mortality rate should be calculated because it's a very strong pointer of many factors, including prenatal care. How far are the mothers cared after? Because infants dying within 1 year after they have been given birth. Were they followed up? Were they given adequate prenatal care, immunization services, and all of that? Breastfeeding and all of that. It also reflects use of tobacco in some Western countries, and even here. Proper nutrition during pregnancy, it tell you. And also behaviors of mothers. Did they actually go for immunization? Could it be that those children died from child killer diseases? It could also reflect the proper nutrition. Sanitation in the home, infection control. So IMR is often used as an indicator of the overall health and well-being of a population, particularly in terms of the quality of healthcare. Many of these things, if there is adequate education, postnatal care, antenatal care, internatal care, IMR will reduce. It also reflects the socioeconomic condition. How do people have access to food? Is the environment polluted? Okay. So lower IMR value generally indicate better healthcare and living conditions, while higher IMR values suggest area for improvement in healthcare and social support system. Take, for example, let's say in 2023 in Ubele, there were 500 reported infant deaths under 1 year of age. And in that year, there were 10,000 live births reported. Calculate the IMR. So applying the formula, number of infant deaths under 1 year of age divided by number of live births times 1,000, we'll have this 50. So the IMR is 50. Therefore, the infant mortality rate from this example is 50 infants die per 1,000 live births. This means that for every 1,000 live births during the given period of time for that 2023, there were 50 reported infant deaths under 1 year of age. And this is very high. Think of this. 50 children die out of 1,000. Like we have only left 950 children out of the 1,000. Now, how much total birth of 10,000 live births? You see that will be going almost to 1,000. It is very high. Okay, so yeah, I will now be thinking, what's the cause of this? So IMR is very important. Okay, so uses of IMR. The uses include health assessment. Health assessment, very, very important. IMR and infant mortality rates provide valuable information about the health status of infants within the population. They help identify prevalent health conditions, track changes over time, and guide public health interventions. So from this, we can say, what is the cause of this children? We start assessment. What is the thing killing these children? What diseases are killing these children? From there, we can institute interventions. Health planning, healthcare plan, like we said earlier, it helps what? In health planning, okay? This rate assists in planning, allocating healthcare resources for infants. They help identify areas with higher morbidity and mortality rates, allowing policymakers to focus on improving the healthcare services and reducing infant mortality. The next is monitoring progress. Yes, it helps us to monitor progress. Let's say previously we have 50 in 2023, and this we were able to put interventions together to reduce it. Good antenatal care, health education, financial support to the pregnant mothers, cash transfers, and all of that. And this year we have 20, so that's reduction. So it helps us to monitor the progress, okay? So they serve as benchmarks to evaluate the effectiveness of healthcare interventions, policies, programs, aimed at reducing infant morbidity and mortality. It can also be used for international comparison, like we said earlier. It is used in for international comparison. You can easily compare Nigeria AMR with that of the US. So research and policy development. When we have high mortality, high infant mortality, researchers go into research to find out what is the cause. And from there, they can develop lawmakers can develop laws and policies to help maternal and child health. That's why we come up with maternal and child care policies. Okay, free nets, sharing of free nets, intermittent preventive therapy for malaria, because malaria is a contributory factor to that and all of that. So common policies, vitamin A supplementation, house to house, and all of that. Severe acute malnutrition, building of centers for acute malnutrition management. So it helps us in that. Another mortality indicator we're looking at is maternal mortality. Maternal mortality. This one is very, very important because it's really, really crucial. We know it because it's also another very important indicator. Okay, this is defined as the number of deaths associated with pregnancy, childbirth, puerperal. Okay, so it's the total number of maternal deaths due to pregnancy, childbirth, puerperal conditions. Okay, and usually measured 100,000. Okay, we don't use 1,000 here. We use 100,000. Okay, total number of what? Live birth. Okay, so the maternal mortality rate is really a ratio used to measure mortality associated with pregnancy. The numerator is the number of deaths during a given time period among women while pregnant or within 42 days of termination of pregnancy, irrespective of the duration, the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. The denominator is the number of live births reported during the same time period. Maternal mortality rate is usually expressed per 100,000 live birth. So the MMR is a crucial indicator used to measure the health, note this, the health and well-being of women during pregnancy, childbirth, and postpartum period. It tells of the health and well-being of women. So that's why IMR, infant mortality rate, and maternal mortality are very, very important. Okay, it gives us a valuable insight into the quality of maternal health care and overall status of women's health within a population. Okay, so let's calculate. Suppose in a particular country there were 200 maternal deaths and 50 live births in a year. So for us to calculate the maternal mortality rates, we'll follow the steps. One, determine the number of maternal deaths in maternal deaths. In this example, there were 200 maternal deaths. Next step is determine the number of live births, which is 50 live births. Then we'll go into calculation. Number of maternal deaths, 200. Number of live births, 50,000 times 100. So by the time you calculate, you are given us 400. So therefore, the maternal mortality rate in the example above is 400 maternal deaths per 100 live birth. Okay. So uses of maternal mortality rates, use it to assess effectiveness of the healthcare system. Like we said, the MMR helps evaluate the quality and accessibility of maternal health services. Yes, it can point us whether the women are actually going to health center or even hospital. It can also show us whether, when they come to that hospital, whether the hospital have enough staffs, enough equipment to take care of those women. Okay, so higher MRR often indicates inadequate health infrastructure. You see, no good hospital, no facilities, or limited access to skilled bed attendants. How many CHUs are there? How many doctors? How many CHOs are there in the health center? How many? It will also help us to know. Okay. And then insufficient emergency obstetric care. This is very important. Because most times women come down with obstetric care, and that's what kills them. Antepartum hemorrhage, postpartum hemorrhage, and all of that. Are there skilled persons to provide emergency obstetric care? So MMR will help us to determine the state in that particular, the state of orders in that particular country or community. Okay. Then next is monitoring progress towards global health. From there, we can also monitor if we're actually following up. The United Nations Sustainable Development Goals include a target to reduce the global MMR. So if your own is not reducing, you will know whether from your MMR calculation that you are not actually meeting up with targets, okay, of the United Nations. The next is identifying disparities and inequalities. The MMR can highlight disparities in maternal health outcome among different population groups, such as the rural and urban. So you can use it. Let's say you are in community Mpo and someone in a community Ogidi. Now Ogidi have higher and Mpo has lesser. It shows that there's no, it could be inequality in distribution of hospitals, health centers, and healthcare workers. Then it also guides policy and resource allocation. Yes, it will help us know which people need these resources more. We need to push it to areas that will have higher mortality rates. Then evaluating the impact, like we said earlier, it will help us know whether we're improving after we have recorded badly or when we have done well. Then in the upper year, we calculate again and we're having something wrong. Advocacy and raising awareness. From the MMR result of the calculator, we can say, we need to go and see the kings in the community. Maybe there's a particular norms or culture or constitution or flockware that is contributing or culture that's contributing to the death of these women, or these women coming down with conditions that will lead to their death, or even betting practices that are detrimental to the health of women. So that is what maternal mortality is all about. Okay, so that is it. Then we will also look at the CDR. So crude death rate, this is the total number of deaths occurring per total population of the area at the mid-year expressed by 1,000 of the population. So there's a formula. Okay, so the crude death rate is an important demographic indicator that measures the number of deaths in a population per unit of population size. Okay, so it helps us, it helps in health assessment, like we said earlier. In other ones, it helps us it helps assist in health assessment. The CDR is a fundamental tool for assessing the overall health of a population. By analyzing the CDR, public health officials, policymakers can identify trends, pattern, and changes in mortality rate over time. Okay, we can from there know whether what is killing the people have reduced or is increasing. Okay, so this information helps in evaluating the effectiveness of the health system, identifying area of concern, and implement appropriate intervention. So by the time the CDR is calculated, we'll know these people are dying too much, and intervention is given. Then after intervention has been given, we'll do again, find out whether there's an improvement or not. Then population health planning. It helps for planning. Okay, population plan. It helps in estimate the future healthcare need of the population. Okay, because the deaths may have resulted from lack of health services, facilities, and resources. So from there, population health planning can be carried out. Then epidemiological studies. Okay, CDR is widely used in epidemiological studies to investigate the causes and risk factors associated with deaths. So researchers can analyze the CDR to identify pattern of diseases, assess the impact of specific disease on mortality rate, which disease is killing more, among which age group and gender. Then international comparison, okay? So compare monitoring public health interventions. We have explained that before. Then demographic analysis, okay? So CDR is also essential for demographic analysis. That was to understand the dynamics of population growth, aging, and what? Migration. So that's all for mortality. That's all for mortality frequency measures. Thank you.